Hey ho, let's go. All right. My name is MarkAlain Dery. It's such a pleasure to be here again for all of my sisters and brothers at Access Health Louisiana. I've been asked to answer some questions about the influenza vaccine because it's time. It's that time to get vaccinated, as well as the interactions with influenza vaccine and COVID, of which there are zero. But we'll get to that in a second. I'm going to try to make this less than 5 minutes. So let's go ahead and get started. So what's new for 2021 and 2022 in terms of influenza? Of course, the composition of the flu vaccines have completely been updated. And here's what's really interesting. All flu vaccines will be quadrivalent. In other words, they have four viruses that they're going to be covering. Usually that's about 3 type A and 1 type B flu viruses. Is this going to be a rough flu season? You keep hearing this word twindemic and what have you. Listen, nobody knows. Nobody actually really knows this, but in order to protect ourselves and our patient, the flu vaccine is truly the best way to do so. So what about flu and COVID-19? While it's not possible to say with certainty what will happen in the fall and winter, the CDC does believe that it's likely that flu viruses and the virus that causes COVID-19 will both be spreading at that time. Relaxed COVID-19 measures such as stay-at-home orders and mask mandates. So in other words, relaxing that may result in an increase in flu activity during the upcoming 2021-2022 flu season, but we don't know for sure, and it's really important that we recognize that. Can I have flu and COVID at the same time? Yes, you can. They're separate viruses, okay? It is possible to have flu and any other respiratory illness like COVID-19 at the same time. Health experts are still studying how common this is. Now, some of the symptoms of flu and COVID-19 are similar. It makes it hard to tell the difference based on symptoms alone. So this is why this is why diagnostic testing is so important when you're sick to help determine if you have COVID or if you have flu, or hopefully not both, but ideally nobody's going to have COVID because we've all been vaccinated. No one's going to have flu either because we've all been vaccinated too. All right. Will a flu vaccine protect me from COVID? No. They're not designed to protect against COVID-19. Flu vaccinations reduces the risk of flu illness, hospitalizations, and death as well. So does a flu vaccine increase the risk of getting COVID? No. Why would it do so? There's no evidence at all that getting a flu vaccine raises your risk of getting sick from COVID-19 or any other coronavirus. And to be clear, the flu vaccine does not at all interfere with the COVID vaccine. In fact, you can get both of them at the same time. And for those of you that have children or that work in pediatric clinics, right, that deal with children, because that's what a pediatric clinic does, you have seen multiple vaccines given in one day. So yes, the flu vaccine and the COVID vaccine can be given on the same day. They do not interfere with each other, completely different technology. Listen, I've also been doing some work with some online publications recently. They've been asking me to tweet the best medical stories of the day. So if you're on Twitter, please follow me at the Dr. Dery. That's the DRDERY on Twitter. You can find the best COVID stories of the day, as well as other medical stories as well. So as always, my AHL sisters and brothers, peace out, y'all. Thank you guys so much. And we will see you guys next video.